organ systems that we have in our body. It consists of various different types of muscles, the skeletal, smooth, and cardiac. The cardiac is found in the heart. The smooth is found in hollow organs such as like the digestive system, and skeletal muscles, anything that we voluntarily move.
This is a diagram of a muscle. There are multiple muscle cells which contain myofibrils, and when the muscle cells come together, they form a fascicle. When there are multiple fascicles that come together, they form the muscle.
This is a sarcomere, which is the contractile unit of the myofibril. It's made up of actin filament and myosin heads. In the actin filament lies the troponin, where calcium ions bind to allow for muscle contraction. In patients with muscular dystrophy, too much calcium ions enter the cell, which can destroy cellular proteins and lead to cell death.
Muscular dystrophy is a genetic disease that's characterized by the progressive weakness and degeneration of muscles. These are the 3 steps that lead to muscular dystrophy. The first is excess calcium destroys cellular proteins, which causes cell death. And then the muscular tissue is replaced with adipose and connective tissue, which is what leads to the weakness of the muscles. Living everyday life with muscular dystrophy can come with many struggles.
I am 35 years old, and I have Becker muscular dystrophy. That means I have a degenerative muscle condition that means over time my muscles will get weaker and weaker throughout my entire life. Muscular dystrophy is really an umbrella term, and that umbrella term covers about 180 different conditions, and all those conditions involve muscles and muscle atrophy in some form or another. Some of the ways my muscular dystrophy impacts me are things like getting out of bed in the morning, brushing my teeth, going out because I have all this extra equipment like my power wheelchair and this ventilator thing that goes with me, and sometimes I have to do things a little bit slower because even when I'm getting up, it's moving me around. Sometimes I have to be careful with my very weak muscles that I don't hurt something. Over the last few years, I'd say advocacy has become incredibly important to me. They asked me to talk to groups of youth with disabilities about moving on with their lives and what it looks like, and how I overcame the barriers that are out there in order to be able to move out on my own, live independently, go to school, things like that. When it comes to some of the myths, I think people think that people with disabilities don't or shouldn't once in a while go out and go to a party or go drinking or go to a pub or something like that, because they just don't think that that's what you can or are able to do. And you can and are able to do that, no problem. And have a girlfriend, yes, definitely.
So there are 9 different major types of muscular dystrophy. The first is myotonic, which is the most common in adults. The second is Duchenne, which is most common in children. The third is Becker, which is common in children, but it's a milder form than Duchenne. And then there's the fourth is the limb girdle, which is weakness beginning in the hips. The fifth is facioscapulohumeral, which begins with the facial muscles. Sixth is the congenital, which is present at birth. 7 is oculopharyngeal, which begins in the eyes and throat. 8, distal muscular dystrophy, which is weakness of muscles furthest from the center of the body. And then the 9th and final major type is Emery-Dreifuss, which is a rare form that mainly affects males.
Muscular dystrophy has no cure, and all of the treatment options are going to be different depending on each case. However, there are 2 different branches of treatments. There are physical treatments and drug treatments. For physical treatments, there are physical therapy, respiratory therapy, speech therapy, as well as appliances for support and corrective surgery. A different type of treatment are drug treatments. Drug treatments include steroids, which slow the degeneration, anticonvulsants, which fight against seizures, immunosuppressants, which delay damage to dying muscle cells, as well as antibiotics, which fight against respiratory infections. In severe cases of muscular dystrophy, patients may also resort to ventilation or pacemakers.
As previously stated, steroids are a treatment option for muscular dystrophy. This is typically used by males. Males with muscular dystrophy begin treatment with steroids at an average age of 7. Roughly 57% to 69% of males are treated with steroids. There are lots of steroids that can be used to treat muscular dystrophy. One of the most common is prednisone. 6 in every 10 males with muscular dystrophy use this steroid as a treatment. On average, males with muscular dystrophy who had not taken steroids stopped walking at about age 10. Males with muscular dystrophy who took steroids for less than 3 years stopped walking at about age 9.5. Males with muscular dystrophy who took steroids for more than 5 years stopped walking at about age 12. As you can see, using steroids can be an effective method to treat muscular dystrophy.
Here are some statistics about muscular dystrophy. Around 250,000 people are affected worldwide by muscular dystrophy. Since Duchenne is the most common, about 1 in 3,500 males are affected, and the symptoms usually arise between the ages of 3 and 6 years old. And muscular dystrophy is most common in Caucasian people and least common in Black people.
Muscular dystrophy is genetic and it is caused by mutation, specifically a point mutation. A point mutation is a mutation where one nucleotide base is added, changed, or deleted. There are 3 types of point mutations: substitution, deletion, and insertion. Substitution is when a base pair is changed. Deletion is when an extra base pair is removed, and insertion is when an extra base pair is added. There are 4 ways to test for muscular dystrophy. There is a muscle biopsy, genetic testing, electromyography, and blood enzyme testing. Muscle biopsy can show if dystrophin, which is a protein that connects the cytoskeleton of the muscle fiber to the surrounding extracellular matrix through the cell membrane, is missing or abnormal. Genetic testing, which tests for the presence of a mutation on the gene responsible for metabolism in muscles. You can also test using electromyography, which are nerve conduction tests. They use electrodes to test muscle and or nerve function. Lastly, there is blood enzyme tests, which look for the presence of creatine kinase, which is an important protein that muscle cells require to function. The presence of this suggests that inflammation and death of muscle fibers is occurring.
In conclusion, the muscular system plays an integral part in how the body moves and functions. When malfunctions occur in the system, the effects can be debilitating. Muscular dystrophy is one such disease that affects many aspects of the muscular system, leading to weakness, difficulty moving, and an impaired ability of vital organs such as the heart to function.